Good afternoon. So for today, we will going to talk about the first topic for finals, which is examination of fresh tissue. So we are now in your histopath topics in your lecture, and I know for a fact that you already have an idea for the following lectures that we are going to talk about because they are already discussed in your laboratory. So just to go back with some few terms, no, when we talk about histology, this is the microscopic study of your normal tissues of the body, while your histopathology is the microscopic study of tissues affected by disease. So the procedures adopted for the preparation of material for such studies are known as your histologic or histopathologic techniques. So in your histopath, no, the tissues are usually obtained during a surgery or surgical procedure during a biopsy or autopsy. So they range from very large specimens or whole organs to tiny fragments of tissue. So for the first half of our discussion, we will going to talk about different surgical procedures that are usually performed to obtain the specific types of tissues or tissue that are submitted to your histology or histopath laboratory for processing. So now let's go to your specimen collection. Moving forward to your fine needle aspiration, which is a type of procedure that we do for specimen collection. So FNA is the simplest and least invasive test or procedure. And this one uses the smallest needle to simply remove cells from the area of abnormality. And please take note that this is not always adequate to obtain a diagnosis depending on the area to be biopsied. So, when you are doing FNA or fine needle aspiration, you really need to confirm that in that specific area there's a cyst, a presence of cyst or a solid mass, whether it be a movable or an immovable mass. So, most common na ginagawa tong FNA is in your breast masses and in your neck mass. So again, FNA is a very simple procedure that involves passing a thin needle. So as you can see here in the photo, no, to a sample fluid or tissue from a cyst or solid mass. So, if you have a growth that may be cancerous, your doctor may recommend getting a tissue sample to confirm whether it's malignant and to determine how to treat it. So, a core biopsy or core needle biopsy allows the doctor to do this without resorting or without doing surgery. So, it's often used to diagnose breast cancer. So, a core needle biopsy obtains a cylinder of tissue about 1/16 of an inch in diameter, and the needle is wider than that used for fine needle aspiration. But since a core needle biopsy gathers more material, so it means that more information is being derived when performing your core needle biopsy. So just to compare lang with your FNA or fine needle aspiration, in FNA, samples undergo cytological examination, which looks at single cells or small groups of cells, while your core needle biopsies allow a pathologist to perform a histological study of tissue structure and as well as cells. So for breast cancer, a core needle biopsy may determine tumor's type, so yung type ng tumor, and whether it's likely to grow slowly, kung mabilis ba siya or mabagal ba siyang tutubo, as well as whether it may respond to a certain therapy. So moving forward to incisional and excisional biopsy. So this is your incisional biopsy and this is your excisional biopsy. So incisional biopsy takes out even more surrounding tissue. So it takes out some of the abnormality but not all. As you can see here, kumuha lang siya ng maliit na sample then eventually no kinlose niya na yung pinagkuhanan niya ng sample. So, the doctor will going to slice into the lesion and remove only a portion of it. And if the lesion is found to be cancerous, so further surgery may be needed to remove or excise the entire lesion. So, pag ni-remove mo naman yung entire lesion or entire area, that is your excisional biopsy. As you can see here in the photo. Again, in incisional biopsy, portion of your abnormality lang. So, you remove only a portion of it. While in your excisional biopsy, you excise everything or you remove the entire area. Okay? Now going to punch biopsy. So punch biopsy is considered the primary technique for obtaining diagnostic full thickness skin specimen. So your punch biopsy is a procedure in which a small round piece of tissue about the size of a pencil eraser is being removed using a sharp hollow circular instrument. Again, gumagamit tayo dito ng instrument na parang ballpen as you can see here in this photo. And this instrument have a circular blade, no? This is your circular blade na ipupush nyo into the skin of the patient. So, pagka-push nyo into the skin, you will going to rotate it down through the epidermis and dermis and into the subcutaneous fat, yielding a 3 to 4 millimeter cylindrical core of tissue sample. Again, we want to have a 3 to 4 millimeter cylindrical core of tissue sample. Now for shave biopsy. So shave biopsy, gumagamit tayo dito ng blade as you can see here in the photos presented to you. So ang nangyayari dito, small fragments of tissue are being shaved, no, from the surface of the skin. So ginagamit natin to most especially sa mga dermatology. So next is your curating. So in here, no, tissue is scooped or spoon to remove tissue or growths from body cavities such as in your endometrium or in your cervical canal. As you can see here, the cervix is first widened by using a cervical canal dilator, and then you will going to scrape tissue in your uterine wall using your curette. Now let's go to the different methods of fresh tissue examination. So please remember that in fresh tissue examination, pwede siyang mag-vary according to the structural and also the chemical components of the cells to be studied, also the nature and the amount of tissue to be evaluated, and the need for an immediate examination of a tissue structure. So this may be done on a fresh and preserved tissue depending upon the necessity. So we basically make the specimen be qualified for testing, and it is hard to reject the specimen. So now let's go through with the different methods of fresh tissue examination, and the first one is your teasing or dissociation. So in here, your selected tissue specimen is being immersed in a watch glass containing your isotonic salt solution. Example of your isotonic salt solution are your NSS or normal saline solution and your Ringer's solution. So again, this isotonic solution is being placed in a petri dish or watch glass. And then afterwards, you will going to carefully dissect or separate your tissue specimen by using a direct or zigzag spread using an applicator stick. So after doing that, you will going to examine it under your microscope, either unstained by phase contrast, or pwede rin naman na may stain using your differential or supravital dyes, and then you will going to observe it under your bright field microscope. So what is the advantage of your teasing or dissociation? So the advantage of this is it will going to permit the cells to be examined in their living state. So, analytical process is done by the pathologist, like for example, the selection of the part of your specimen. So, next is your squash preparation or crushing. So, in here, small pieces of tissue not more than 1 millimeter in diameter are placed in a microscopic slide, and you are going to forcibly compress it with another slide or with a cover glass. So, if necessary, a supravital stain may be placed at the conjunction of the slide and the cover glass, and you will going to allow it to be absorbed by the tissue through your capillary attraction. So next is your frozen section. So in frozen section, it utilizes when a rapid diagnosis of the tissue in question is required and is especially recommended when lipids and nervous tissue elements are being demonstrated. So, very thin slices yung kailangan natin dito between 10 to 15 micra are cut from fresh tissue frozen on a microtome with CO2 or on a cryostat and then transferred to a slide and processed for light microscopic studies. So, what is your cryostat? So your cryostat is a cold chamber kept at an atmospheric temperature of -10 degrees Celsius to -20 degrees Celsius. So what will be the advantage of this method or your frozen section? So the advantage of this method is that meron siyang rapid processing time with less equipment requirement and less need for ventilation in the laboratory. But the only disadvantage for this method is that it has a relatively poor quality of the final slide. So moving forward to smear preparation. So smear preparation, this is a process of examining sections or sediments whereby cellular materials are spread lightly over a slide by means of a wire loop or applicator or by making an opposition smear with another slide. So this technique is especially used in cytological examinations, particularly for cancer diagnosis. So what are the different methods of smear preparation? We have streaking, spreading, pull apart, touch preparation, or impression smear. So let's go first with your streaking. So in streaking, with an applicator stick or a platinum loop, the material is rapidly and gently applied in a direct or zigzag line throughout the slide, attempting to obtain a relatively uniform distribution of section. But please remember that too thin or too thick smears have to be avoided because they make the tissue unstainable for examination. So next one is your spreading. So in here, a selected portion of the material is being transferred to a clean slide, and afterwards you will going to gently spread it into a moderately thick film by teasing the mucous strands apart with an applicator stick. So it is especially recommended for smear preparations of fresh sputum and bronchial aspirates. And also for thick mucoid secretions. Please remember that spreading is a little more tedious than streaking but has the advantage of maintaining your cellular interrelationships of the material to be examined. So next is your pull apart. So pull apart, this is done by placing a drop of secretion or sediment upon one slide and facing it to another clean slide. So the material disperses evenly over the surface of the two slides. So the two slides are then pulled apart with a single uninterrupted motion, and the specimen is placed under the microscope for immediate examination or applied with vital stains. Please remember that slight movement of the two slides in opposite directions may be necessary to initiate the flow of your materials. So lastly is your touch preparation or your impression smear. So this is a special method of smear preparation whereby the surface of a freshly cut piece of tissue is brought into contact and pressed onto the surface of a clean glass slide, allowing the cells to be transferred directly to the slide for examination using your phase contrast microscopy or staining for light microscopic study. So it has an added advantage in that the cells may be examined without destroying their intercellular relationship. Now, let's thoroughly discuss your frozen section. So, again, ano ba yung purpose or para saan ba yung frozen section? First is that for rapid diagnosis of tissue. And second, this is recommended for lipids and nervous tissue elements. No? So, method, so it makes use of very thin slices. So, between 10 to 15 micrometer cut from a fresh tissue frozen on a microtome with CO2 or on a cryostat. So again, no, na-mention na natin kung ano yung cryostat. So again, your cryostat is a cold chamber na merong temperature between -10 degrees Celsius to -20 degrees Celsius. So, important thing to remember in the method of your frozen section. So, the thin frozen section are mounted on a glass slide, fixed immediately and briefly in a liquid fixative and stained using similar staining techniques as in traditional wax embedded sections. So, what will be the applications of your frozen section? So, this is used again for rapid pathologic diagnosis during surgery, diagnostic and research enzyme histochemistry, diagnostic and research demonstration of your soluble substances like your lipids and carbohydrates, immunofluorescent and immunohistochemical staining, and some specialized silver stains in your neuropathology. So please remember the different applications of your frozen section. Now let's go to your freezing methods. So in freezing methods, we have a term called your rapid freeze. So rapid freeze is slow freezing o mabagal na pag-freeze that causes distortion due to ice crystal artifacts. So ano-ano yung mga freezing methods? We have the most rapid and commonly available, which is your liquid nitrogen. We also have your isopentane cooled by liquid nitrogen, your carbon dioxide gas using your, so this is incorporated with freezing microtome. We also have your aerosol sprays, and your aerosol sprays, please remember that this is not for muscle tissue. So, na-mention natin that the most rapid and commonly used agent is your liquid nitrogen. This liquid nitrogen is for histochemistry and ginagamit siya during operative procedures. So, ano-ano ba yung mga disadvantage ni liquid nitrogen? First is that soft tissue is liable to crack due to the rapid expansion of the ice within the tissue, producing your ice crystals or freeze artifacts. So please take note that overcools urgent biopsy blocks will going to cause damage to both block and blade of the microtome if sectioning is done at -70 degrees Celsius or below. Also, your non-fatty and fixed tissues are sectioned well at temperatures between -10 degrees Celsius and -25 degrees Celsius. Your isopentane cooled by liquid nitrogen is a combination of your liquid nitrogen and your isopentane. Please remember that your liquid nitrogen may cause uneven cooling of the tissue. And if it happens, just freeze the tissue with your isopentane. So, when using your isopentane, you need to prepare a Pyrex glass beaker and place the liquid nitrogen until it reaches half liquid and half solid stage. And after that, isopentane is added. So again, no, for your aerosol sprays, so it provides adequate freezing for small pieces of tissue, again, except for your muscle tissue. And these aerosol sprays are readily available in the market. So sabi natin your aerosol sprays, hindi siya pwede sa muscle tissue. So the question is, ano naman yung excellent method for freezing muscle tissue? The answer is your isopentane. So now let's go to your cold knife procedure. So in here, a piece of filter paper is soaked in a gum syrup that is placed on the microtome stage. And then a short burst of your carbon dioxide are applied, freezing the filter paper on the stage. Then afterwards, the selected block of tissue, approximately 3 to 5 millimeter thick, is then oriented on the stage, applied with a few drops of gum syrup and frozen solid with several intermittent bursts of your carbon dioxide, each for 1 to 2 seconds duration at intervals of around 5 seconds. So it should be frozen just to the point where it will be firm enough to section. Then the tissue is then lifted up to the knife manually and trimmed until the surface is flat. So that the surface is then warmed with the finger until the hard frozen tissue starts to thaw and becomes visible to the naked eye. So this is the dew line. So yung dew line is the point at which sections may then be cut at 10 micra thickness. Please take note that sections do not form ribbons but rather stick to the knife blade and should therefore be removed with a camel hair brush or finger moist with water. So they often transfer to a dish of distilled water to separate and pick up individually for mounting and staining. And the water dish is usually placed on a dark or black background in order to see the sections, which are usually colorless or very light in color. Optimum condition for sectioning shall be provided by the following temperatures. So for the knife, it should be between negative 40 degrees Celsius to negative 60 degrees Celsius. For the tissues, it should be negative 5 degrees Celsius to negative 10 degrees Celsius. And for the environment, it should be 0 to negative 10 degrees Celsius. So the success of this procedure depends upon the ambient temperature and humidity. So it is very hard, if not impossible, to cut sections in a hot or humid environment. So ease of the cutting and quality of the section are always improved if done in a cold room. So sections thinner than 6 micra generally cannot be obtained even from tissues that section well and with ideal conditions for sectioning. So now let's go to your cryostat procedure. So cryostat, so this method makes use of the cryostat. So an apparatus used in fresh tissue microtomy. So the cryostat consists of an insulated microtome housed in an electrically driven refrigerated chamber and maintained at temperature near negative 20 degrees Celsius, where your microtome, knife, specimen, and also the atmosphere are kept at the same temperature. So please remember that the optimum working temperature of your cryostat is between negative 18 to negative 20 degrees Celsius. And majority of the sections can be cut in isothermic conditions where the temperature for sectioning can be accurately established and controlled. So, dapat yung tissue for freezing should be fresh and freezing should be done as quickly as possible. So, slow freezing can cause distortion of tissue due to ice crystal artifacts. The success of fresh tissue sectioning depends to a large extent on the temperature, both of the tissue and also your knife. So certain tissue such as your fat or mucin and hard or dense structures in a soft matrix require much lower temperatures to impart a suitable consistency for cutting. So these are sectioned again on the cryostat by lowering the tissue or knife temperature or both. So either by placing the block holder in a bath of alcohol or acetone containing dry ice or by exposing the tissue to your carbon dioxide. Moving forward to mounting of tissue blocks. So synthetic water soluble glycols and resins are generally used as mounting media for tissue blocks that need to be sectioned on a cryostat. So your OCT or optimal cutting temperature compound, Labtech Products Division of Miles Laboratories Incorporated is especially recommended. So it is marketed in convenient 8-ounce plastic dispenser in three temperature ranges depending on the tissue being cut. So you need to remind yourself with these following temperatures. So between -5 to -15 degrees Celsius, this is required for brain, lymph nodes, liver, spleen, uterine creating, and soft cellular tumors. So for -15 to -25 degrees Celsius, this is for non-fatty breast tissue, ovary, prostate, tongue, and your gastrointestinal tract. And lastly, -35 degrees Celsius for fatty breast and omental tissue. Again, we need to set the cryostat temperature between -18 to -20 degrees Celsius, and preferably the tissue block should be between 2 to 4 millimeter thick in order to minimize the risk of the knife hitting the metal tissue block holder. So the frozen tissue is mounted on the microtome. Both the microtome knife and the tissue block are left in your cryostat for 15 to 30 minutes at -20 degrees Celsius. So sections between 5 to 4 micra are then cut slowly and steadily removed from the knife with a camel hair brush attached directly to slides of cover glasses at room temperature, air dried, fixed, and stained. So another important point to remember is mounting cryostat section. So in here, one edge of the glass slide is rested on the knife surface about 1 inch beyond the section, and the other end is lowered gently until it is about 1/2 to 1 millimeter from the knife face. So the section will automatically transfer from the cold knife to relatively warm slide. So some important points in freezing previously fixed tissue. So sections of formalin fixed tissue may not adhere to the slide and will fall off or be detached during staining. So to enhance the attachment of frozen fixed sections, clean slides should be coated with albumin or chrome glycerin jelly, or the tissue block may be immersed in boiling 10% buffered formalin for 1 to 2 minutes before freezing and sectioning for rapid surgical diagnosis. Special fixatives such as your 10% formol calcium at 4 degrees Celsius may be used in histochemistry and for lipid demonstration. So, tissues that have been fixed or stored in alcohol should be washed in water for 12 to 24 hours before sectioning since your alcohol inhibits freezing. So here are some important points with regards to care of your microtome. So please go over with this slide. So now let's go to some special processing techniques. So the first one is freeze drying. So this is a special way of preserving tissue by rapid freezing, quenching of a fresh tissue at negative 160 degrees and subsequently removing ice water molecules by physical process of transferring the still frozen tissue block in a vacuum at a high temperature without the use of your chemical fixative. Now going to freeze substitution. So this is similar to freeze drying and preparing and preserving tissue blocks for subsequent infiltration and also embedding of your frozen tissue block in paraffin. The only variation is that the frozen tissue, instead of being subjected to dehydration in an expensive vacuum drying apparatus. So in here, this is fixed in Rossmann's formula or in 1% acetone and dehydrated in absolute alcohol. Your freeze substitution is based on rapid freezing of tissues followed by solution or substitution of ice at temperatures well below 0 degrees Celsius. So, a 1 millimeter to 3 millimeter specimen is thrown into 3:1 propane isopentane that is supercooled by liquid nitrogen to negative 175 degrees Celsius. So for the processing of tissues, please remember that a better and more effective means of studying tissues is by examining of their sections and smears which have been permanently preserved, stained for demonstration of specific structures, and mounted on glass slides with cover slips for permanent keeping. So, in comparing naman your fresh versus your preserved tissue examination. So most fresh tissue are very delicate. So they are easily distorted and easily damaged. So preserved tissues naman provides the efficiency of staining for better demonstration and permanent keeping when mount on slides with cover slip. So, ito yung process of your tissue processing. So, first, we do fixation, followed by decalcification, next is dehydration, clearing, impregnation or infiltration, followed by embedding, trimming, section cutting, staining, mounting, and lastly, labeling. So in your fixation, it preserves the tissue by stopping all cellular activities, and the primary aim of fixation is to preserve the morphologic and chemical activities of the cell. So it is used to prevent na mabulok yung specimen or prevention ng breakdown of your cellular elements. So just to reiterate on what you already know in your histopath laboratory. So, for the characteristics of good fixatives, so dapat cheap siya, stable, safe to handle, mean to say hindi siya corrosive, can kill cell quickly with minimal distortion. Dapat ay inhibit niya yung bacterial decomposition and also your autolysis. Dapat magpo-provide siya ng minimum shrinkage lang and penetrate rapidly and permit application of stains. And lastly, dapat isotonic, insoluble to hypotonic. So next is your decalcification. So alam nyo naman that decalcification step is optional, and in here, ginagawa natin dito is we remove your calcium or lime salts from bones or calcified tissues following your fixation. So more concentrated acid solutions decalcifying more rapidly but may destroy tissue. As you can recall, the ratio should be 20:1 with the duration of 1 to 2 days lang. So, ano yung mga different decalcification solutions natin? We have your HCl, pwede ring formalin plus HCl, or EDTA only for slow decalcification for immunohistochemistry. We also have your dehydration. In here, we dehydrate, no, or we remove the excess water to the tissue. And please remember that the volume should not be less than 10 times of your tissue. So the procedures in your tissue processing will be thoroughly discussed in your histopath laboratory, like your clearing, impregnation, embedding, creaming, sectioning or section cutting, staining, mounting, and as well as your labeling. So that's all for your fresh tissue examination.